I'm Chiropractor, Dr. Gregory Johnson. We have Tony here with us this afternoon, and this is Tony's very first visit to a chiropractor, and he came in here complaining of IT band pain, especially over here on this right side. No, it's on the left side, wasn't it?
Right side.
No, it was right side. It was right the first time. He's had right knee surgery on the lateral meniscus down here, and he's had pain in this right IT band ever since. And we're going to evaluate his posture first and show you some things. Let's have you flex your head forward and backwards for me, Tony. Just your head.
Oh, my head.
There you go. Now see, he's got limited flexion and extension there. Now neutral. Just if you can go around to the front right there, I want to show him. His head's forward in the Z-axis. His ear's dropping right here over his clavicle. That's why his shoulders are rounding a little bit. But if you notice, he's translated a little bit to the right of center. That's why his left shoulder looks a little higher than his right shoulder. And then down here in the pelvic area, you can see that this left hip is translated to the left. His hand's over his pelvis here, and over here is not. So his pelvis has translated to the left on the x-axis, and his thoracic spine is rotated on the z-axis to the right, which kind of makes him tilt off to the right there. So we did some tests on him, and I'm just going to go over the positive ones. Let's go on your tummy for me first there, Tony. We did a full orthopedic neurological workup on him already, and the reason I don't go over all those is because those are private HIPAA details in most cases. But I want you to come down here and look at how short this right leg is comparatively. It's almost 3/4 of an inch shorter on the right side. And I look right where the heel meets the sole, not on the bottom of the shoes. See, that right leg's way short. Now, watch what happens when I bring him up. It actually gets longer, and I bet you that tightens up in the low back and the pelvis and probably the thighs and even your knee. So see, his leg got longer when I did that, even though it's shorter here. So that tells me he does not have an anatomical short leg on the right side. It's a functional short leg from a right sacroiliac subluxation. And is that tender right there, Tony?
Mm-hmm.
Yep. So he's got a sacroiliac joint that has rotated like this. It's pulling the leg up with it. So it's rotated posterior, inferior, and internal. And that's tender right there. Now that also goes up into the lumbar spine. L5's out there. There's L4 and L3. These are all a little tender. And then palpating his paraspinal muscles. His right paraspinal muscles are much tighter than his left, all the way up into his lower thoracic spine here. And as I palpate his thoracic spine, that's a little tender right there. That's the spinous process. That means the vertebra is sunk down inside of the ribs. And then his neck's out on the lower right side at C6, C7. And also at C2 and C3 up here. And a little bit on the left here at C4. And we're going to have you lock your right leg straight and lift that whole right leg off the table. Okay, do the same thing on this left side now. I see the left side's more difficult for him to do, so he's got a posterior left sacrum subluxation here as well. So we're going to be adjusting his right SI joint first, and then his sacrum on the right side, the center, and the left side, and then his left SI joint. So we'll go ahead and get started doing that now. You ready to feel better, Tony?
Mm-hmm.
All right. You want to adjust your right SI joint first. Now remember, this is his very first adjustment ever. And I'll let him tell you how he feels afterwards versus when he walked in the door. I'm on his sacrum now. I'm adjusting this left sacrum straight superior to inferior and also in the Z-axis to get it back into normal. Good. I'm going to adjust the internal rotation out of this right ilium. Right there. There. Now I'm going to work up to L5, straight P to A. L4, straight P to A. L3 has a slightly upward angle to it, as does L2 and L1. Okay, just relax and breathe. There you go. Same here. Just keep exhaling. Okay, good. Okay. There it is, right there. I knew it was in there. Okay, we're gonna come down here and recheck his leg length now. And looky there, lo and behold, they're even. And I bet you this already feels a little easier to you than that first one did. Did that feel easier in your low back?
Yeah, it did.
Still tightened up in your thighs though, didn't it? Scoot up in here just a little bit more for me, Tony. There you go. So you're gonna feel your headpiece popping up next. That was C5-6, that moved really well. There's C7, so did that. I'm putting the curve back forward in his neck now. Let's turn you on your back now, Tony. I'm going to be adjusting his head now on the x-axis. I'm going to help get his head back up over his shoulders where it's supposed to be. I'm also adjusting that back in the Z-plane as well. There, good. Now we're going to slide down this way a little bit. Now he's had rotator cuff surgery on this right side too. Let's put your arms out like this, straight out to the sides. Palms up. So I'm going to be adjusting both AC joints here. And then his sternoclavicular joint right here on the left first, and then the right. And now I'm going to adjust his costosternal joints and the anterior ribs here where they attach to the sternum. There, good. Okay. Now we're going to get into the most painful part of this treatment for him. You might want to come over here, Joseph. I'm just going to have you kind of straighten that leg out. Now he's got it right. What a lot of people call their IT band is really the tensor fascia lata muscle, which goes from the iliac crest all the way down the lateral aspect of the thigh and attaches into the tibia. But I'm doing some transverse friction across that IT band and tensor fascia lata muscle. The fibers run this way, longitudinal, so we want to go across those fibers. This is kind of tender, isn't it? Mm-hmm. You'll feel a lot better when it quits hurting. This is not a comfortable treatment, but it's very effective. Good. Now I'm also going to adjust his knee and his hip here. Just let this go limp. There you go. Oh, I know you felt that.
Oh my God.
Bet you never felt that before. There you go. Good. I'm actually going to work on this left IT band here too. TFL. This is not as sore as the right one, is it?
Mm-hmm. No, it's not.
Did you feel that pull all the way up into your hips when I pulled your legs?
Yep, I did.
Good. Okay, so go ahead and scoot back up that way just a little bit. I'm going to do a muscle test on you now. I'm going to pull this out and you try to resist.
Okay.
This is weak, isn't it?
Mm-hmm.
Is that tender here and up in your hip as well? And probably your knee a little bit too. So that's the sartorius muscle. That muscle runs from the anterior superior iliac spine right down into the medial tibia here. And it runs across the longest muscle in the body. So I'm doing some Golgi tendon muscle spindle work on this. It's probably a little tender too.
Yeah.
Yep. And then his psoas muscles right here in the anterior superior iliac spine inferior aspect right here. I'm gonna push down, you resist. That's pretty good. Now I'm gonna push on this simultaneous with that. See the difference?
Yeah.
Okay, do that again.
Oh.
Yeah. But watch the difference here. I'm gonna pull out, resist. Yep, look how much stronger that is that time. Probably still sore, but it was stronger. Let's check this one while we're doing it. I'm gonna pull out, resist. Now see, this one's much stronger. That didn't hurt as bad either, probably did it?
No.
Good, we'll still work on that for you. Okay. So now we got the easy stuff done. Let's come over here on this table now, Tony. There we go. We're going to have you lay on your back on this table. I'm going to have you put your pelvis right here. Head up this way. There you go. Alright. Slide down this way just a little bit. He's back. You getting all ready for the Super Bowl, Tony?
Not really.
We've been talking about it a lot.
Oh.
We're probably going to stay out of everybody's way here in Houston. It's going to be all crowded and busy. More than so than usual. You're a Houstonian, right?
I am.
Yep. So who do you think's going to be in the Super Bowl?
Oh, probably Patriots and
Packers.
Packers. Yeah.
There you go. See, he's a man after my own heart. He's kicking before the ring dinger. Now, he hasn't seen any of our YouTube videos, so this is going to be a brand new adjustment for him. Tony, what I'm going to do is I'm going to put some traction in your spine from your skull all the way down to your pelvis here.
Okay.
It's going to take compressive stress off the disc, off the joints, and off the nerves. So you'll feel this sweat tail under your skull and your chin. Keep your teeth together. Take a breath through your nose. Just like that. Now you should have felt that all the way down.
God.
Did you?
I did. Oh, crap.
Keep breathing. There you go. You're still kicking. All right. That's why we call it ring dinger. Okay, now I'm going to adjust your neck, so just let your head relax in my hand.
Oh,
Yeah.
God.
There we go.
Oh,
Here,
God.
put your hands right here and relax. Okay, wiggle your left big toe and think about something else. There you go.
Oh, God.
Yes, sir. You didn't know you were that noisy, did you? This is his very first chiropractic adjustment.
And he's never watched the video. This is good.
Okay, so now I'm gonna help you sit up sideways, and when you get up, you always want to start getting up sideways. Bring your legs over and kind of get up like that. Push yourself up with your arm. I'm gonna have you stand here and face the mirror again for me now, Tony. Now, I'm gonna have you close your eyes again and bend your head forward and backwards again. It should already feel a little easier. Much better range of motion. Now back to neutral. Take a look in the mirror right now. Look how you're more centered up now. Your shoulders are level. But here's your home exercise right here. You're going to pull these guys up and back.
Okay.
Hold them there for me. Flare these guys like that. See how that tightens up your whole trapezius muscle. Then we're going to bring your head straight back. Yours is a little to the right, so what we're going to do is go left. You're tilted to the right, so once you tilt left, tilt your spine left from right here.
Right here?
No, just tilt left.
Okay.
There you go, from right here. Okay, I'm going to pull that left. Now look up at the ceiling. You're going to feel a little tap right here. You're going to feel another little tap right there. Okay, now relax. Now I want you to try that same thing again and tell me if this feels any different to you. And what feels different about it?
It just feels like it's smoother.
Yep.
Yeah.
See, I didn't put those words in his mouth. He said that all on his own. Because it is smoother. It always feels like I put a little WD-40 in there, huh? Take a look in the mirror right now. See, you're standing up, more level here now. Your hand's not as much over this one. You want to, when we do that exercise, pull these up and back. You want to bring your head straight back. You're going to translate it to the left. You're going to tilt left. Nope, tilt left.
Okay.
This way. Now shift your pelvis way out right simultaneously. That's your exercise right there. And you want to do that 15 reps 3 times a day. So it'll look just like this. And then shift your pelvis way out.
Okay.
But you want to look in the mirror because you want to keep your head straight, but you want to translate it and tilt your spine right here.
Okay.
Shift that pelvis way out to the right. And just breathe in. Exhale. That's 1 rep right there.
Okay.
And then 15 of those in the morning, 15 around lunch, and 15 in the early evening or afternoon, you'll be good.
Okay.
And I'm going to have Joseph work on you for the next 15 minutes on some deep tissues, including your IT band, tensor fasciolateral muscles, and your psoas up here as well. And he's going to show you a home exercise to do at home. You might want to video that too, Joseph. if you don't mind.
No, don't mind.
Okay, thank you for sharing
thank
your
you.
very first experience. What would you tell people about your very first experience here at Advanced Chiropractic Relief?
Well, I guess I would tell people that it's a lot better. It went a lot better than I expected. I heard different things, good and bad, about going to a chiropractor, but so far so good. The experience has been really good.
Thank you for sharing your story with us.
All right.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, home of the Super Bowl. We'll see y'all soon.